All right, so thank you everybody for joining tonight. So I was just thinking about when we talked earlier, you know, the motivation behind this is two things that I've seen recently on social media. Number one is the quote that is, "We do not want to go back to normal because normal was not working," right? So we want to make sure that we have a plan in place when it comes to prevention in the future. And then the other thing is the quote that this pandemic did not create an economic or health crisis for our communities, it exposed it. So what are we gonna do moving forward to fix that? So with that, for those that watch this replay, we're gonna all introduce ourselves so that you know who you have in here. And then we're gonna start our discussion on really what is the reason that the Latino, Hispanic, and African-American communities are hit so hard, and how can we formulate a real plan so that we can go forward and move up from there. So James, you want to introduce yourself first?
Sure. James Gonzalez. I own Work 365 fitness expert, as well as an author of kids' books, and also a sports trainer for athletes.
Mr. Max Main.
Hello, everyone. My name is Jermaine Max Main Bronner. I'm the co-owner of Anytime Fitness, owner of Max Effect Nutrition Bar, and also I'm a community health prevention specialist. And I'm happy to be here.
All right, and my friend Therese.
Hello, everyone. I am Coach Therese Teasley. I'm the founder of Driven by Purpose LC. I also am a life coach, certified life coach, as well as a professional speaker here in the city of Pontiac. And so my focus is women's wellness, focusing on the whole person, as well as inner healing and self-identity.
And then I am Tashina Gonzalez. I am a holistic wellness coach. So I help people with natural ways to deal with everything. So obviously I am not a doctor. So while they work with their doctor and follow all those instructions, we find natural ways to reduce high blood pressure, to deal with stress. And we provide additional holistic solutions, promoting exercise, herbs, essential oils, and things of that nature. And we will move over to the introductions of our other two guests who have joined us. So Miss Angela, can you please give us an introduction of who you are and what you do?
I wasn't prepared for that, but I'm Angela. I'm a personal trainer here in Pontiac. Founder of Change That Mindset Fitness. Nothing too major.
Thank you. Yeah, so we are recording this, just so you know. I'm live on Facebook on my business page, so I will share it to everyone that needs it later so they can share it all over Facebook. But with that, Max, I'll turn it over to you to start us off with our discussion.
Okay, what's going on, Angela?
Hello.
Can you repeat the question so Angela can hear it again? Just to
Absolutely. So the crux of our discussion tonight is to make sure that we have an open discussion based on our personal knowledge, our research, some of the articles that we have reviewed. Why really, when we look at our state of Michigan, Southeast Michigan, Chicago, some of these other areas, why is it that African Americans only make up 10 to 15% of those populations, yet they're getting 40 to 60% of the cases of the pandemic that's going on? So why is it that the Hispanic and the African American communities are getting harder hit? And how can we, as healthcare professionals in every single holistic area, come together to create a prevention plan so that we can move forward from this?
Got it. You said you want me to start it off? Okay. Okay, no problem. So, and I'm glad we're having this this topic and this discussion, because the media can show a picture of young African American teenagers at a gas station gathering, And yes, they should practice social distancing and to kill or to stop the spread. But however, I want to let everyone know, white, black, no matter your race, that that's not the reason why African Americans are 3 times more likely to die from COVID-19, because they wasn't practicing social distancing. All groups of people there are groups in all races that's not practicing social distancing. So we got to get that clear.
Mm-hmm.
So we have racial disparities, we got socioeconomic reasons, and we got health reasons, our immune systems, right? So for example, when it comes to vitamin D alone, you know, vitamin D by itself, all African Americans living above Tennessee are vitamin D deficiency. Now we got to realize the sun and vitamin D, the sun alone is antimicrobial, antiviral. So the vitamin D is very important, not just for strong bones, but for the immune system. So if you are vitamin D deficient, if your immune system is already compromised, when you come into contact with a virus, whether it's HIV, the cold, or COVID-19, you're not going to be able to fight it off as fast as a person that's have a strong immune system. You get what I'm saying? So even when it comes to the underlying diseases, you know, I read an article in the National Institute of Health, how a group of postmenopause women, they increased their vitamin D intake to 11,000 IUs. And when they did that, they decreased their chances of developing cancer by 60 to 77%. See, information like that is, we don't hear that in our household. We don't have professionals that's coming up to school, that's coming up to us to remind us to take something like vitamin D. And if they do bring it up to say, hey, you're vitamin D deficient, if they just leave it there, we're going to go to the commercials of Michael Jordan, our favorite athletes, wearing milk mustaches, right? But what some of the health professionals from other ethnicities don't know is that, or don't remember, is that 75% of all of African Americans are vitamin D deficient. Now I'm not gonna waste this time. I mean, not vitamin D, but lactose intolerant. I'm sorry. 75% of African Americans are lactose intolerant. So I'm not gonna use this time to beat milk down, but if we don't strengthen our immune systems, and this is just one part of the whole story, but we need to strengthen our immune system. We get a lot of information talking about wash your hands, wear your mask, but what about, what can I do to put myself in position so that when it comes next year, it won't kill me?
Right.
No one is talking about that.
Right. Absolutely. So, I mean, I've seen some, like you said, the articles are far and few between, but I have seen lots of articles that have stated, you know, well, we all know that they're saying for the high risk people to stay inside. What does that mean? That means the people that are obese, the people that have heart disease, the people that have diabetes. And again, those are more prevalent when it comes to the inner cities. And the exact same thing, like I've been doing what I can to piecemeal all this stuff, vitamin C, vitamin D. And yes, the article that I read stated that just if you are dark skinned, period, you don't get the same amount of vitamin D from the sun, period. That you just don't. And the further away you are from the equator, like you just said, Tennessee and above, right? Because we so far from the equator, we get so much less sun. Like we have to be addressing those things. So yes, I have friends in other states. I have friends in Texas. I have friends in Florida. I have friends where there are beaches. And yes, there are certainly other ethnicities that are not practicing social distancing. But that is not the real reason, because we have 10 other reasons that are against us in this fight that we're trying to do. And 100%, like in addition to washing your hands and following all the guidelines. And that's another thing. I think like there's been some people that have been real upset on Facebook when there's some of us that are health professionals talking about we're not worried about it or comparing it to the code. And I don't think that they understand. We're not saying this isn't a crisis. We're not saying that we shouldn't social distance. We're not saying none of that. But what we are saying is we don't get codes because we already do this stuff. And if you guys added this stuff in, we could reduce the mortality rate faster.
Absolutely. Absolutely.
I like how you said that. Also, to add with that, and even if we did get it, our immune system is to the point where we're going to fight it off at a rapid pace. And that's what they don't understand too. Like, the chances for you to let this progress in your system is really slim. And that's because we're doing all the proper guidelines and the proper steps. And not just that, it's just a lifestyle for us. And that's what we wanted to become for everyone else, is make it a lifestyle. The sooner we could get the community, our neighborhood, the people to understand that it's a must. It's not an opinion. It's not nothing to argue about. It is a fact. It's a must. We have to live a healthy lifestyle. We got to get our immune systems up. That way we can fight anything that come our way, COVID-20, whatever the next disease or whatever the case may be, we'll be prepared for it. And that's why we're doing what we're doing right now. But with that being said, can we talk briefly about the effects of the ones who do have it, the case, and if you don't have it, how can stress or being stressed?
Oh yeah, Miss Therese, like, yeah, I mean, manifesting sickness, girl. I know you can vibe on that.
Listen, let me talk about it. So I had a situation at work. Well, I always have situations. So this one, it's a young lady. She's older. She's like 89. And she was talking about, oh, I got this pain in my body. I feel like crap. I don't want to get out of bed. I don't want to do this. I said, you know what? After today, you're not going to say that. You're going to start saying, I am pain-free. So when I had asked her this morning how she felt, she told me she was feeling bad. But then when I told her, I said, say I'm pain-free. So I went back in for lunch. Don't you know, she already started to feel better, only because she started believing what she said. And so that was that she was pain-free versus being in pain. So we have to watch what we say. We have to watch how we think. So sometimes you can be like, oh, I'm all in this pain and stuff like that, and then you start stressing, you start worrying, you start doubting yourself. You have all of this fear in your mind and in your body and in your thoughts, and then you will not be healed, and then you cannot heal. So you have to train your mind. And I like Angela because her business is called Change That Mind Fitness. I'm thinking I'm saying it right.
Please, that mindset, girl.
Yes, they go change that mind. So you got to change your mindset. You just have to change your mindset. So once you change your mindset, you live stress-free, and then you don't have fear. Guess what? You'll start to feel better. So that's why I say I love to focus on the whole person. So the inner healing has to take place. And so once you do your inner healing, then guess what? You won't be sick because you're going to feel better. You're going to start doing things that make you feel better. That's like going outside for a walk. Because for a minute, people will say you shouldn't go outside. No, you need to go outside, because if you don't go outside, then your immune system is going to be what? It's going to be broken, and it's going to be weak. So you have to go outside. You have to get the sun. You have to just do some things that you're not used to doing, and that's going outside. And then I like the fact that right now a lot of us are off work and being able to spend time with your family. So that's a part of the healing process too, and just changing your mindset, because now you can think different, and then now you can spend time at home feeding your kids and feeding yourself good nutritional food. So this is a good thing right now, because you're not focusing on working and not sleeping, but instead hopefully you are resting. So resting is a part of this too, the healing process. So thank you.
Yeah, and I think back to those of us too that, we share articles about what the actual statistics are and what the recovery rate are and stuff like that. And that's really what we're trying to do. We're trying to bring the positivity to it. And, sometimes people come to us like, thinking that we have a flippant attitude or whatever. And that's not what it's about. It's about sharing the whole story and making sure that the mindset, understanding that we're not promoting fear. We're promoting what the real story is, and we're promoting other alternatives to support yourself. So yeah, absolutely. That mindset is everything, because you can truly manifest sickness if that's all that you focus on.
Mm-hmm. And you can also manifest health. So that's why you got to see it before you even experience it. So I see myself healthy. So I'm working on being healthy and I'm actually living it. So if you speak it, it shall come to pass, but only if you believe it. And then you got to work it. So that means you got to eat, right? You got to get enough sleep. Then you got to take rest. You got to rest too. Listen to your body, because this is your temple and only you can control the outcome. So if you sit up here wearing and watching the TV, I done had to start cutting the TV off, because it's like you can be watching it, listening to the news and listen to the effects that COVID-19 has and how they saying the statistics are high for African-Americans, Latinos, and everything else. And it's like this, you sitting up here putting that into our minds and we starting to believe it, like, oh, we got these high numbers because this is what the statistics say. Okay, so start believing something different. Start watching the not the news, but watching the workout videos and start doing it, and then you'll start feeling good and you'll get healed because you're starting to believe something different. So that's it.
Yeah, get up and do something. Be active. This is the time where we can actually go out and be active, and we got the free time. No one is actually taking that time to go out and hit the trails, just walk around. I don't see nobody outside. They're trying to get natural exercise through their body.
Man, let me say this real quick. I speak for myself. I don't know about any of you all right now, but I didn't realize that I had a little bit of stress in me before all of this had taken place, because I was up at 5 a.m, training, working out, grinding, all the way up until 9 at night, literally. Like all day, I've been on the grind, training, and I didn't realize how stressed out. So when this did happen, this actually helped relieve some stress. And I hate that it happened, don't get me wrong, but I had to put things in perspective. So when we do get out of this rut and we do get back to regular life, I know, okay, I got to cut back on some of this stuff, because I was stressed out.
Real
You
talk.
see what I'm saying?
Yeah.
So this actually really opened up my eyes and helped me realize that, hey, it's time for you to cut back and think about what's really important. And for me to be able to be in a health, career and fitness career, and me helping other people, I gotta be, stress-free in order to do that. Because at the end of the day, it could become a domino effect.
Yeah,
So,
absolutely. And that's where the whole holistic, that's why we all on here, right? Because those of us that do practice the mindfulness and the sitting in silence and doing all that, we got to help bring that to the active people, right? So that's the whole holistic portion of it. And the fact that we can use this time, like we talked about originally, for leverage. The reason why all of us are working 12-hour days is because we all have our dream that we are chasing, but how can we come together right now and leverage so that we are working together, and then we only have to work 8-hour days instead of 12, because we know that we are coming together as a group with pieces.
Right. And everything that you're talking about, working 12 hours to your environment, all of that have to do with health. Again, when you see an unhealthy community, you're going to see unhealthy people. So, for example, I'm gonna ask you all a question, or the viewers. What group of people are more likely to have 8 family members but to live in a 2-bedroom home? So if one of the family members catch a cold, you can't practice social distancing. When it comes to being an essential worker, what group of people are more likely to be the people working at the hotels making the beds, the people serving the food, the Uber drivers, and the people who have to cut hair and personal training and do hair just to keep their business going? What group of people are more likely to have more underlying diseases and to live in communities where they're surrounded by highways, so they're dealing with pollution, they're dealing with bad water? See, it's not just about a person eat bad. This is why they're more likely to die from heart disease, respiratory issues, hypertension, cancer, and all these other underlying diseases. See, you have situations going on at the hospital where African Americans are saying, listen, I'm sick. I'm sick. I work here and I'm sick. They say, no, go back home. Go back home. Go back home. And sometimes you can deal with racial issues even in the hospital. See, it's bigger than just this person eat chips or whatever. You get what I'm saying? So we have to deal with it on, it's our jobs as health professionals, trainers, and we specialize in different areas, but we don't specialize in all areas. But what I believe is that, to go back to what you were saying about the stress, we dealing with stress as far as work, but I believe that most people that's dying from COVID-19, yes, they had a weak immune system, but fear is stress. Fear will kill you faster than COVID-19, than almost anything. I read a study, and I don't want to take up all the time. Matter of fact, I don't even think it was a study. I think it was in my Napoleon Hill book. But anyways, it was a guy, he had got sentenced to life in prison. They blindfolded, they said, you know what, we'll let you out in prison if you pass this test that we want to conduct. So he like, what else do I have to lose? They blindfolded him and put him in a room to where he couldn't see. And what they did was they said, okay, I'm going to cut you and you're going to bleed. And if you wake up in the morning, if you're still alive, you can go home. So what they did was they made sure that it was water dripping in a puddle. So he heard the doop, doop, doop. But all they did was make a small paper cut. He wasn't bleeding at all. So because he believed that he was bleeding to death, and he, you know, when you get scared, the first thing you do is sweat, your heart start beating fast, and your body start messing with you. So he was so scared that he was going to die, his mind, he was bleeding to death, that he died from a heart attack. So fear will kill you. So this is why information that we're bringing on this live feed is very important, because Pontiac, Saginaw, Flint, Detroit, and urban communities get a D+ or an E when it comes to health literacy. We're not scared because we understand, most of us understand how a virus works. And we understand that it's not just about putting sanitizer on our hands and wearing face masks. At this point, it's not if, because we all can get COVID-19. No matter how healthy you are, you can get it. We probably got it and don't know it because our immune systems are strong. But it's not if you're going to get COVID-19, it's when. And when you do get it, do you have, is your innate immune system strong enough to when these pathogens come your way, you have fighter jets that can come and fight the situation off. Now, when you have these underlying diseases, your antibodies is already dealing with diabetes or obesity, is already compromised. So we have to look at it this way. Our body has so many soldiers. Say if our bodies have 10,000 soldiers called antibodies. If you have hypertension, if you're obese, if you have these underlying issues, then the soldiers that's there to fight off pathogens is already fighting underlying diseases. So when COVID-19 comes and your soldiers is already fighting, then all they did is went through the back door and now it's choking you from the back because your immune system is not strong enough. And I don't want to get too deep into it, but another reason is that people who have underlying issues have what they call ACE2 receptors, which means that they have more doorways in the lungs and in the human cell for COVID-19 to enter the body. So this is why it's important for people to practice, sick people to practice social distance, because if you have an underlying disease, you have more doorways for COVID-19 to get in your body, and also you don't have enough soldiers to fight it off. And on top of that, you're stressed out because the media is showing you everybody from newborn babies to celebrities dying. So once you get it, the stress then already beat down your immune system. Because when you're nervous or when you're scared, when you're mad, that's when you catch a cold. That's when some people get cold sores. That's when some people get skin reactions because their body is stressed out. So now it's kind of like fighting a 12-round fight, and you tired and you ready to go home, and it's another guy saying, no, you got to fight me now. Your body already beat down from all these things that's happening to you. You stressed out, you a secretary, you sitting down, you on a computer looking at your bills, you don't know how you gonna pay your mortgage or your car note. So now you stressed out. When you get stressed, your body creates cortisol. Once your body creates cortisol, then now you starting to gain weight. So once you educate yourself on health in your body, the next time COVID-19 come and flu come, you're not stressed out no more because you're like, oh, I'm not vitamin D deficient. I work out at least 30 minutes a day. I get rest. I drink. Well, I have enough soldiers to fight. So I'm not scared for me. I'm scared for you. I'm practicing social distancing not for me, but because I don't want to come around nobody such as yourself, because your immune system, we can give it to you. So I think that health literacy programs, for example, I don't know if y'all probably saw the video. I did a simple video on how to take your vitamins. And so many people, they didn't want to comment, but so many people called and inboxed me and said, you know, I've been taking those type of vitamins for years with just water. I didn't know the difference between water-soluble and fat-soluble vitamins. My doctor, even though my doctor told me to take this food with a meal, I thought I could just take this vitamin A, B, okay, with a cracker. I didn't know you had to take it with a healthy fat to absorb it. So little information like that, what we are doing, showing videos of how to exercise, showing videos like Tariq's doing how to handle stress, showing videos like Sheila doing on how to get rid of toxins. And we're saying it in a way that's not going over people's heads. When they go to the doctor, their doctor is from India. When they go to the doctor, sometimes their doctor is white and don't understand culture. So they're using words and stuff, assuming that we know basic stuff, and all they're saying is, you need to go take your medication and you need to get some rest. They're not breaking this shit down like we can break it down.
So we got a couple of people in here that haven't chimed in yet, so I did want to give them an opportunity to share their viewpoints and their thoughts. So if you guys want to come off of mute and share your perspective on what we've shared so far. Karima, are you available?
You got to give me a second. Y'all keep talking.
Okay, no worries. No worries.
That's my girl.
But yeah, just to piggyback off a couple of things that have been said, the other thing is, Max, you touched on a couple times about the toxins, and for a person who's immune compromised, for a person that has high allergies, for a person that has asthma, some of the solutions to this are detrimental to them. So if no one has gone around and read the back of their bleach bottle, I suggest after this you go read the back of your bleach bottle. You are supposed to have goggles, a face mask, and gloves anytime that you use bleach. And then you cannot be in the same room until the whole smell is gone, because it's that detrimental to your immune system. Yet that is the solutions that already immune compromised people are given to use. So that's part of the education that we need to get to people, because there are plant-based solutions, there are herbs, there are things that you can do that are not going to harm your immune system.
Are we able to do a summit, a health summit for individuals in our community? So people of color, whether it's Latinos or whoever, just people of color, or anybody that is willing to do it, we can get the information out very soon, because I think we have the opportunity, the best opportunity now to educate people. So whether we're talking about being stress-free or just giving them information about all, or not just limited to COVID-19, but just things that we are dealing with, because Max, he hit a lot of stuff on the head when he was talking about stress, and then how if you look at our communities, like when people have like heart problems, a lot of the times it depends on what type of job they have. So you might have doctors and nurses and people like direct care workers that used to take care of people, and they used to have to carry all of their weight, take on their stress, and so they are prone to are more at risk of having like heart problems. So like me, I'm always carrying other people, so I can have heart problems because of the simple fact the type of work that I do. So we just want to educate people, like caregivers and doctors and just people of our community, on like the risks and just like stress and how you need to change your mindset and everything else and be free.
We have to.
Yeah, so I mean,
We have to.
the intent of this is we've recorded it so that it can be a resource to share with people.
Okay.
So someone like myself that spends a lot of time with the Pontiac Regional Chamber and the Waterford Chamber and Healthy Pontiac, now I have this as a resource to give. Max has resources and people he's communicating with, and that would be our ultimate goal, to garner. How can you support us, whether that is funding, whether that is you putting your name on this, and where do we go forward? And that really is part of the discussion. Like you mentioned, what would be amazing is a one-day symposium on basic health. I mean, what else does this group want?
And I do want to say one thing, like I work with the community at large. And so a lot of the people that I deal with, it's like the senior population, as well as like single mothers and things like that. They need this information. So if we're able to put something together where it's like all of us have our own areas that we specialize in, we're talking about it and giving the statistics and giving ways where they can be healed from, everything that they might be wrestling with, just how to live life freer, because so many times we can be entrapped in our own minds and be sitting up here stressed out because we're worrying about our bills being paid, we're worried about our children, we're worrying about all of the things that we have going on personally, and that's causing us to be even sicker. So I can't wait to see how all of this comes together, because our community members need it, and I can't wait to put it out there in the atmosphere.
I think it's going to come together nice. I had a new client or a new team member for online training and whatnot, but she said because of the coronavirus, it really woke her up to a lot of health issues and how the health issues that she was dealing with or that she was avoiding. But with that being said, she also said, to be quite frank with you, I don't even know where to start. You see what I'm saying? That's why I said something like what we're doing right now is so convenient, and people need it, but they just don't know how to start or don't know how to open up or talk about these things. That's why I say our jobs are so valuable. The information we're going to provide is so valuable to help the next person achieve their health and fitness goals. So what we're doing is amazing.
Absolutely. One thing about especially myself, James Gonzalez, Karima, and Angela, it's fun, but our job is different. We all, and I'm gonna speak for all of us. I'm quite sure all of us have had a few clients, at least one. They was working out every day. They switched their diet, right? And they still could not lose the weight. So I'm quite sure in the beginning of your journey, you take it personal. You like, man, I know I'm giving you that work. And you switch, what's going on? And this is why people like ourselves, when we sit down and we have a consultation with the client before they even start, they open up to us more than they ever opened up to their primary health physician. They get deep, they get personal. Us being trainers, physical training experts, we have to also be a friend, a psychologist, a pastor. We have to be the nurse. We have to be the doctor, because we not just trainers. You get what I'm saying? You got to realize that when most people come to us to lose weight, we're not just fighting against burning calories doing physical activity. We're dealing with individuals who have diabetes and do not know how to even take their medicine or handle it. And we all know that diabetes is one of those diseases that causes you to store insulin, and insulin is a fat-storing hormone. So we have this client to where we're telling them just to work out and eat right, but we didn't have time to become experts to really dive deep and teach them how to handle their diabetes, because that's what the doctors are there for. So now we have to educate ourselves. Now we got to be a diabetic expert. We got to go and look up information on cancer. We got to go and look up information on stress management, because all those things are roadblocks in stopping this person from losing weight. And so now we don't have the information of your doctor or whatever, and you don't lose the weight, we don't make money. See, if we was living in Birmingham, we wouldn't have to be the doctors and stuff like that. They got doctors, they have their dietitian, they have their nutritionist, they go get massages that help, they do, what you call it, acupuncture, whatever the hell that shit called, to relieve stress. We dealing with individuals that all they have is us. Before I train, I gotta vent to you and tell you about this abusive relationship I'm in. Before I work out, I gotta tell you about me battling with insecurity issues. So we gotta be there as a friend. So we in Pontiac, we dealing with so much when it comes to being unhealthy. It ain't just that the person don't want to work out or the person don't want to eat right. This person was in an abusive relationship. This person just got out of prison. This person is about to lose their house. This person has got their kids taken away. This person got a car note, they're dealing with stress. So this is why what we do is very important. We need to get essential worker back.
Mm-hmm.
Because we still training right now, not because, yeah, we can get an unemployment check too. But we know it's people around here, if they don't got Giants, Kareem, and Andrew, they might go somewhere in Therese, they'll probably go kill themselves.
And Tashina, they gonna have us now.
We already know. We already know. For real.
Yeah, you right.
They should be coming to y'all like crazy, no?
Yeah.
Because you dealing with unemployment, man. That's enough to stress you out.
So I think on a higher level, I don't know what I'm doing. I'm going to send pressure to the politicians, city,
you need it.
State level. Just say, listen, man, we know about the hand sanitizer. And we got our free bag lunch. Thank you. But we got people around here that's risking their lives to do the things that y'all getting money off our data for.
Yeah.
I'm glad, Tashina, I'm glad you work with Healthy Pontiac and a lot of those health organizations. And I hope they see this. Well, how come I can't go to your organization and get a brochure that give me information on how to strengthen my immune system, being an African-American or Latino? So the next time this situation comes, I don't need your bag lunch. And I'm not scared, I'm more stressed out. You read the data. You received the funds for it. Where's the preventative measures at?
I want to jump on that while you on fire, and I hate to cut you off because I'm that person. I'm the community health worker. So as a life coach, but I do community health work too. So I hear the needs of the people. So those people that can't pay their light bills, do you think they actually worry about going to the gym? No, they trying to figure out how they gonna rob Peter to pay Paul. Then you got those ones that need transportation. You need those people that need housing. So they're like trying to figure out how I'm going to have the money to pay for my next meal. So the one advantage that we have, You have expertise. I have expertise. Everybody on this call has expertise. So now all we have to do is put all of our expertise together, write up a plan, because we got to make the vision and we got to make it plain. So all we got to do now is write it up, and then the people that need us, they're going to come to us and say, how did y'all help change the city of Pontiac? How did you help change your neighborhood? Because now we're not going to the big organizations, even though we can. I'm not saying not to go to the organization, but what I'm saying is we have so much, and all we got to do is share what we have, build the plan, create the foundation, and make sure that it's solid, and then just put the information in people's hands, because now they need us the most. Because when I tell you, I have people sleeping in the parks that needed help but wasn't able to go to an organization, but their health was failing them. So we had to make sure that we focused on the whole person. So you and everybody else that's a personal trainer, y'all getting those people and y'all are unpackaging, because you're sitting up there listening to everything, every issue that they have, and you're being able to help them relieve stress. So I love the fact that we are coming together to collaborate, and I think this is going to be amazing if it is done right. And so that's why we got to make sure we putting all our pride to the side and listening to each other so we can help people. Because I'm telling you, if it's done right, we gonna help our community, and it's going to be it's like going to be a ripple effect, because the people are waiting on us to just give them what they need. That's why when I do my inspirationals, I try to encourage people, because I want them to know that no matter where you are, no matter what you've been through, no matter what you have experienced, you can still be an overcomer. And when they hear that, they start to believe it. So the more we speak life into them, the more we make provision for them, they remember that it's not about money, but it's good to get the money so you can pay for what you need. But money can't pay for this. This is priceless, this information, and to be able to touch the lives of people like me. I'm a person that's been overweight all my life, but I had to go deep within to figure out what it was. So now when you come to a person or meet a person that has been struggling with self-identity, that has been abused, that can't go to their mama, can't go to their family, but then they could come to you and tell you their story, and then it be like they probably can't pay a lot of money, but when you go to Bloomfield and you go to those other cities, they have the money. And then you have, like us, we got a lot of nonprofits that are supposed to do stuff for our community, but they're not able to do it because there's so many different ones. So I just love the fact, like I said, we're coming together, we're hearing the needs of the people, and so now for us to be able to have this information for them, we're going to help change lives, and they're going to look back at this moment and say, dang, they helped me so much to get so much farther than I've ever been in my life. So thank you guys.
Okay, look, I just want to say, I'm not trying to be Miss Karina. Somebody got a lot of feedback in the background.
Oh, okay.
Yeah, I hear a lot too.
Okay.
I agree with everything that was being said. And me personally, I don't have time to be an expert in everything. I'm sorry. I'm a whole wife. Yeah, I'm a whole mama. I got, outside of when we train, we have other things that we are a part of. And my strength is the spiritual aspect of what comes along with an individual. And I understand that. And I know adding that along with the being able to let them know how the physical ties in, that's help within itself. Now, when you want to go on deep and stuff, okay, you got a man that's there. Extra. I have no problem passing people along to other people. I'm not trying to be the know-it-all. I don't have time to be the know-it-all. So I think that will kind of move pride and stuff out the way when it comes to coming together. It just seemed like it'd be so hard for us to come together because everybody want to be seen, everybody want to know, show what they know. None of that is important. Because like you saying, ain't nobody thinking about working out and they already got extreme beings in their cabinet. You see what I'm saying? Or people coming in and broken from the inside. Ain't nobody thinking about doing no leg lift or doing no jabs. So being in our community and understanding where the struggle is, I think we got to start from where the struggle is. and slowly start to incorporate how that health aspect will kind of eliminate the struggle. But just let y'all know, I'm not trying to know everything. I ain't trying to do everything. I ain't trying to be no genius. No. What my strengths are, I'm gonna work them boys real hard because I know who I am and what I can do and what I'm capable of. So as long as I think everybody know we grounded on our strengths, and when we come together and we say, okay, well, you take this area, you take this area, you take this area, things are going to flow so much better because everybody ain't going to be trying to, oh, well, she was doing this or this, well, what she do or what he do. And it's just a bunch of confusion. Just know the enemy going to try to come in and cause confusion because that's his job. He going to try to come in because what we're trying to do is change. We're pushing life. And the enemy comes to kill, steal, and destroy. He ain't a part of life. He don't want to see nothing live or nobody live. So us coming together, pushing an agenda of life, just know he gonna try to creep in and creep in our group and try to cause confusion. But that's not, it's not gonna stand, and it's not so. But I just know how he works. So as long as we can get a stable plan of who gonna work on what and who gonna do what, and when we come together, that's going to eliminate a whole bunch of stuff. In this group, this is where the success is going to come from. So that's just, but I'm all in. I thank God for everybody here. I really do. And y'all can keep talking about it.
Hey, Karima, can you do us a favor? Can you tell us the name of your business, who you are, and tell us your specialty, the area you focus on?
Fight Club Fitness Hub. You know, I'm Karima, and I'm right downtown Pontiac. Well, I kind of just incorporate everything as far as the workout from low impact to high impact. But my focus is women, families, children. I want to build a generational inheritance of health and wellness. Like I think I heard Max say, we ain't growing up in a home where they talking about health. We're not growing up in a home where they say, okay, go sit down and just chill out for a second and write down your thoughts. You see what I'm saying? Being told that your mental is important, your spiritual, your emotional. For some of us that come from Black homes, we've been taught the spiritual way of things, but it has not taken root. It has not taken root. We just repeat what we say. So I'm in a place to where now it's time for you to fight for your faith. You got to fight. We fighting every day. We fighting every day anyway, whether you want to or not. You're fighting every day. How about we fight with strategy now? It's just about fighting with strategy. That's what Fight Club is about. So whatever area I can help in, that's the area where we're gonna put some strategy to it, and that's where Fight Club come from.
Here we go.
Absolutely. I don't think this is the time to really talk about the original plans. This video was just to talk. I mean, this is just to talk about. I think why are African-Americans dying more than any other race. But I do want to say, I say that to say that I do want to say that I believe that us as health professionals and trainers, we got 60,000 people in Pontiac. I believe that each and one of us should be assigned to at least however many people, 10,000 people, 2,000, 1,000. You get what I'm saying? Like I told James, it's not enough of us. It's not enough trainers. If you really look at it, it ain't nothing like Karima said. You ain't never gonna try to creep in and say I'm trying to. But if you really think about it, it's not enough trainers. It's not enough healthy people. We only like maybe half of 1%. So it's our job to scream. We got to scream at about 59,000 people. We got to convince at least 59,000 people that we have to serve. And according to the stats, 80% of the people in Pontiac need us. They need us, man. If you look at it, from a city level, from a county level, to a state level, to a federal level. Who has came to Pontiac, Detroit, Saginaw, and said, I really want to teach y'all health literacy, besides y'all? During this time, it's just my goal is I want to make sure that people like us, we can get looked at, we can get the same respect that police officers get. We get the same respect that firefighters and the ambulance drivers get. And also, you know, we're down at a fast-ass rate. So if you want to come to our community and use our data and say, you know, it's 60,000 people in Pontiac and 40,000 are obese and have diabetes and heart disease, and we want to get funded so we can help them. I just want to let everyone know that's watching this, we need your help. Where you at? We have a lot of nonprofits that's making sure people get transportation and get food. But one thing I learned about Pontiacs or dealing with a lot of Democrats or whoever, we got thousands of them that don't mind giving you a lunch. They don't mind giving you something that to where they can help you. But we're all on a program so that we can help our damn self. We know that you will give us a check. We know that you will give a grant to give us some food and to give us some vouchers. But what about them programs that will give us the skills so we can get paid $100,000? So we do have those jobs in Pontiac. Where are the health literacy programs that's going to teach us about real health and wellness, so that we can pass it on to our family and they can pass it on to their kids and we can kill a generational curse? We don't want to take a picture with it and smile and say, look at the good job. We need resources. There's no brochures that have been passed out in Pontiac talking about prevention. And it probably won't be unless we create it. So I feel like this is why it's important. This is why I felt like God put it on my heart and said, man, y'all need to reach out. Because me watching the news, seeing people I grew up with die, seeing this person and this person, and the only thing they saying is, excuse my language, wash your goddamn hands and put a mask on. Then we've been number one when it comes to heart disease. We've been number one, like Tashina said. COVID-19 isn't the real problem. We've been down from heart disease and cancer. Just put a flashlight on it. So, like James said, this is a blessing and a curse. You know, we got friends and family that died, but just like sometimes when you, and I'm probably the only one that in this group that know about this. When you get put in the back of a police car, you start praying. You start thinking about your kids. You start thinking about God. You start thinking about how you're going to change your whole life. I'm hoping that what we can get up out of this is people can start to become more aware about their health. In the same way how they was behind, and some people can be behind that police car, and they start remembering about that. They start remembering and thinking about their freedom. I'm praying that at least people can say, oh my God, I almost lost my life. I need to call Angela and give me some bands. I need to call Kareem. I need to go to Fight Club and get that spiritual motivation, something that not only that's going to help me work out, but it's going to help take away my stress. I need them oils from Tashina because I got respiratory issues. I got asthma. I need to get these toxins up out my house. I hope and I pray that people become more in tune with their health and give me a chance so when I go in the grocery store, I don't have this feeling like the whites, the people from other ethnicities is looking at me like I'm a disease. Because on the news, they said black people they died of COVID-19, so they think that we got it. So instead of making me feel funny because I'm black, now I feel funny because I think that you think I got the fucking coolies. That's all.
So we are actually going on an hour. I know we want to keep this to about an hour or less for sure. So I guess we can end it now. Anybody got any last words or comments?
Why don't you give them some quick health tips that they can do to boosting their immune system, whether it's working out, praying, whatever. Just quick tips.
What tip I got for you guys, if you're stressing out, one of the best ways I know to relieve stress is to go for a walk or a run. That's it. Clear your mind, get some fresh air. Okay, get some vitamin D and you get that sunlight, fresh air, clear your mind, go for a walk or a run. That's all I have right now.
Do you a little bit of yoga?
Absolutely.
Meditate,
For sure.
breathe in a little bit. Just take time for yourself.
Talk to a friend. Talk to somebody that's gonna make you laugh. That love you and you love them. Encourage somebody. The best way to give out what you need.
Absolutely. That's it?
Yeah, absolutely. Focus on gratitude and that positivity that we done already talked about, for sure. Like, there's still things to be grateful for. Practice some deep breathing and meditation, and there's focus on the positive, because when the second that you focus on the negative, when something happens, let it hurt, let it bleed, and then move on and focus on the positive and the gratitude.
My tip is push. Pray until something happens and release everything that does not belong to you. Let go of fear, worry, doubt, anger, hurt, depression, all of that. And just think on nothing but positivity and do what you were created to do in love. And that's it.
Eat a damn apple too. Thank you. It goes a long way.
You know what? My quick tip, I want to keep it basic, man. During this time of COVID-19, they're giving people bridge cards, and there's really no excuse. I understand when you leave your house, if you're busy, you may have to stop at somewhere and get a snack, but you should surround your house with healthy food. If it's a battle in your own house, then it's gonna be so much harder for you when you leave. Instead of the big bag of chips with the clip on the top of your refrigerator, replace it with fruit. Have some healthy stuff visual in your house. So when you snack or you having that craving for sugar, you can reach right on the table and grab a banana. And just don't buy the shit. That's rule one. Just don't buy it. Now when you go out, then that's a whole nother devil. But in your house should be a safe place. Yeah.
Absolutely. So with that, we will end this. Appreciate everybody that joined. Again, this is going to be uploaded to YouTube, and I will send within 30 minutes the link, as well as pass the link on Facebook to everybody to share in their respective groups. And I will talk to you all and see you all later for the next sets. Thank you, guys. Bye.